Initiative for Health Accountability and Transparency. Welcome you to Leadership Management and Governance, Module 4. And this module is on managing health workforce for optimal performance. The outline of this module includes introduction of basic human resource issues, definition of human resource for health, types of human resource for health. We will look at basic human resource functions and also managing key aspects that influence performance of workforce. And then we'll look at the conclusion of the module. The learning objectives is that the participants will understand the concept of human resources for health, discuss what makes up the human resources for health. They will understand basic human resource functions and also be able to discuss the essential aspects that influence the performance of our workforce. Let us look at some basic issues on human resources for health, HRH. HRH is one of the three principal health system inputs. Others are physical capital, which includes the infrastructure and the equipment, and other capital projects, and also supplies and consumables. These resources are expensive and quite often in short supply. Therefore, the issues of managing priorities will continue to be a recurrent issue in health system management. Let us take a brainstorming session. What is human resources for health? You may wish to take down notes on key issues of your understanding of human resources for health. Taking the definition of human resource for health. Human resource for health is also known as health workforce and is defined as all people engaged in actions whose primary intent is to enhance health. Human resources for health is one of the building blocks of our health system. Now, on the types of human resources for health, we have two categories. We have the clinical component and we also have the non-clinical component. The non-clinical component is often referred to as the supportive component. The clinical component includes the physicians, nursing professionals, midwives, dentists, pharmacists, laboratory scientists, other allied health professionals, community health workers, and social health workers. While the non-clinical or supportive component includes the health service managers, medical records, and health information technicians, it also includes the health economists, the health planners, health supply chain managers, and medical secretaries. Let us now take a second brainstorming session. What do you understand by human resource for health functions? You may also need to take note down of keywords on your understanding of HRH functions. HRH functions are the activities that are carried out by human resource experts, human resource managers, or personnel to improve healthcare delivery and meet desirable health outcomes through recruitment, maintenance, and development of both clinical and non-clinical health managers and providers. Another area we will also want to look at is what are the HRH functions. In the like manner, you may also need to take notes down on the keywords of your understanding of what HRH functions are. The basic human resource functions are often classified into 11 categories, and they include planning, recruitment, selection, and placement for vacant posts. It also includes providing job description and contract, job induction and orientation. It includes all coordinating activities. It includes communication, conducting meetings, promoting staff motivation, performance appraisal. It includes supervision, continuing education, and managing interpersonal conflicts. Let us now take each of these functions one after the other. Like I said earlier, there are 11 of them, and we'll start with planning, recruitment, selection, and placement. Now, the first thing that confronts a human resource expert or manager is human resource planning. And what do we understand by human resource planning? It deals with estimating personnel requirements in terms of numbers and the categories of personnel required both in the immediate and long term, and allocation of resources for their training and also for paying them. Let us brainstorm on methods that can be used in calculating health personnel requirements in an organization or workplace. You may wish to note down in keywords what, in your opinion, or your understanding of methods that can be used. Primarily, 4 methods for calculating health personnel requirements. We have the health needs approach. Let us look at coordinating activities. Coordinating activities means the synchronization and integration of activities, responsibilities, and control structures to ensure that the resources of an organization are used most efficiently in pursuit of a particular objective. Coordinating activities helps to bring activities into proper alignment or relation with each other and avoid duplication. It does this by distribution of authority, providing the channels of communication to prevent conflict, and arranging the work so that the right things are done in the right place, at the right time, in the right way, and by the right set of people. Let us look at communication. Communication is key and is an essential aspect of management. Communication refers to the process of relaying messages in a way that is effective and resulting in a response. Good and effective communication promotes teamwork. Personal relationship within a team can be difficult, but poor communication will worsen them. To encourage communication, the following should be emphasized. A message should be clear, that is, it should not be ambiguous, whether provided orally or written, and in a simple, clear language. Conflicts are common, and they should be resolved in a way that will achieve constructive results. Let us take a brainstorming exercise on the types of communication flow. What is our understanding of communication flow? There is downward communication, and messages flow downward from manager to subordinates or from a service provider to clients. This is the most frequently used type of communication in healthcare delivery. Communicating downward can help the manager spell out objectives. It can also help the manager change attitudes and also mold opinions. Communication flow is about the direction of communication. A scenario where messages flow from one direction without a feedback system is an inefficient and unproductive situation. There is also the upward communication. This is communication which flows upward from a client or a patient or a subordinate to the supervisor or manager. It enhances the sharing of opinions and experiences in the process of planning, implementation, monitoring, and evaluation. Unlike downward communication, upward communication allows decision making to take place at the grassroots level, and managers being supporters and catalysts in this process. There is also the horizontal communication. In this type of communication, there is lateral communication between people working at the same level in the organization. A director with a director, or a consultant with a consultant, a resident doctor with a resident doctor. Messages in horizontal communication usually relate to task coordination, to problem solving, to information sharing, and conflict resolution. In addition, an established horizontal communication could serve as a basis for collaboration and networking with related sectors, government and non-governmental agencies, political leaders, and multinationals and donor agencies. We have looked at communication flow. Let us now look at the communication channels. Is there a difference between communication flow and communication channels? Communication channels are the paths through which a message is transmitted from the sender to a receiver. And we know that these channels are many, and today with the advent of emails and internet, networking is rapidly becoming a major type of horizontal communication flow, and this knows no borders. With computer and internet, linking up with email and social media is possible, and these are today playing key role in health communication. Meeting is very, very important, and it is often used for communicating with staffs. At such meetings, services and programs running in the health organization or in the service provider institution, local government area can be discussed and recommendations made for future actions. Meetings also provide opportunities to clear or clarify uncertainty or misunderstanding among members and deliver new information on policy or implementation issues and plans. Meetings are also used to discuss complaints and welfare issues from staff and for interaction between different health workers to share experiences and for timely attention to urgent issues and specific problems. Meetings are also used for adoption of decisions, resolutions, and recommendations. How do we prepare for the meeting? The purpose of the meeting should be clear and communicated. The main subject matter or agenda should be known before the meeting. If the subject is new, somebody with knowledge on the subject matter should introduce the subject. And it should be considered whether it should be open to the public or closed for members of an organization only. The size of the meeting should be noted. Ideally, meetings should not be too large because they become difficult to manage. The place, time, and duration of the meetings should be made clear, and they should be clear about who is convening and organizing the meeting. And there should be announcements or information on the meeting that is widely circulated to those that are invited. There are some key issues about conducting meetings. It is good to keep in mind that too many meetings can interfere with the ordinary work routine and can become a huge body. The chairperson should be somebody who can encourage good communication. Quarrels and shoutings at meetings should not be allowed because they indicate that communication is poor. With good communication and discussion, agreement and compromise should be the outcome. The chairperson should control the meeting and allow effective discussion. Looking at staff motivation, what do you understand by staff motivation? You may wish to take notes down on keywords of understanding of staff motivation. Staff motivation is a factor or factors that induce an employee to pursue work-related task or goal. It is also the level of energy, commitment, and creativity that a company's workers bring to their jobs. Having understood the meaning of staff motivation, what are the various ways of keeping staff motivated? You may also need to pick a pen and also note some of the key issues based on your understanding of factors or those things that can boost staff motivation. There are about 8 factors that are widely recognized to boost staff motivation. Starts with salary and conditions of service, with the working environment, achievement factor, recognition factors, the work itself, the responsibility that is attached to the work, advancement and promotion, and self-improvement and training. We can take time to look at each of these one after the other. Looking at salary and condition of service, they are very, very key and most fundamental motivation factors. Salary constitutes an important source of income for employees and determine their standard of living, and they affect productivity and work performance. There is also the issue of environment. The environment should be conducive to work and make staff stay motivated. It is essential to create a work environment in which employees are productive to increase the profits of a company and a business. A positive work environment should be safe and open, that includes all the elements of fun, support, openness, and care. It should be motivating and challenging. The achievement aspects. On this aspect, the HR manager assists staff to reach success and achieve their aspirations in life. This affects the way they perform their tasks and motivates them to show competence at work. There is also the issue of recognition. The staff are recognized for good work performance and praise is given or awards where it is due. The work itself is also a motivating factor. The HR manager explains to staff the value of good work they are doing and motivates them towards that, and also encourage them to achieve more. There is the advancement. The HR head helps staff train for promotion and advance in their career. This is a motivating factor for staff. There is the issue of responsibility. The HR manager helps staff to take responsibility. On self-improvement, the organization provides opportunities for personnel development through training, through coaching, and through mentoring. Let us now look at performance appraisal. What is our understanding of performance appraisal? Performance appraisal is a systematic, general, and periodic process that assesses an individual employee's job performance and productivity in relation to certain pre-established criteria, targets, and organizational objectives. The purpose of appraisal is to identify employees' current levels of job performance, identify employees' strengths and weaknesses in order to determine individual and organization's training needs, and also to assess the employee's level of contribution as a basis for determining salary, wages, increments. How do we prepare for performance appraisal? There are steps that we need to take in preparation for performance appraisal, and this includes deciding what aspects of performance is to be appraised, collecting the information needed to measure performance, judging the degree to which norms and standards are met, developing norms and standards against which the appraiser is compared and are judged, and consulting job description. We mentioned earlier that job description is an important tool for performance appraisal. Also looking at work assignment instructions, technical procedure manuals, etc. Others include designing performance appraisal tool. It could be a checklist or performance procedure manuals, and also having a team that will conduct the appraisal, and encouraging individual self-evaluation appraisal is always very, very important and encouraged, and deciding what to do next after the performance appraisal. Let's also look at the issue of supervision. Supervision means more than just a visit to a health facility or a provider. Supervision refers to an activity of more experienced or higher positioned personnel overseeing the work of their juniors so that it meets set standards and expectations. Supervisors are expected to be organized, and also technically competent. The purpose of supervision primarily is to assist health workers achieve work outcomes and to find out work problems and challenges and respond to that by finding a solution to those problems together and encouraging team members to apply their ability and energy to work, explaining to subordinates the value of work. We have mentioned before that the value of work is one of the boosters of staff morale or motivation, and understanding what makes people dissatisfied at work. There are three main styles of supervision. Supervision can be autocratic, it can be laissez-faire, just like we have a type of leadership, and it can also be democratic. Let us agree on what we are going to do. Looking at continuing education, what does continuing education mean to us? Continuing education is education program that is designed to educate an individual and give him or her further skills or knowledge to be applied in his or her line of work. And there are many approaches. It could be formal lectures, it could be courses or seminars, it can also be webinars or podcasts. Health management teams should recognize the importance of an efficient, updated, and motivated workforce for managing health services. It is the responsibility of a health management team to ensure that plans for continuing education for various health cadres are formulated both on long-term and short-term basis. A human resource training profile for various groups and organizations must be maintained and also regularly updated. There is an important aspect, and that is training needs assessment. It is recommended that health managers should conduct assessment of continuing education needs for various categories of health workers. The objective is to find out the performance gaps or differences for each cadre and prioritize the needs in accordance with what they actually see in the field. What methods are available for continuing education? We have the meetings are also important for sharing information. In clinical practice, you have ward rounds and you have clinical meetings. Supportive supervision is also another key method. Workshops and seminars, webinars, and podcasts we have mentioned earlier. And the aims of continuing education are to share and exchange experience with colleagues, like we mentioned in clinical meetings or ward rounds, and to avoid professional decay and continue ignorance, and to expose personnel to new ideas, to motivate health workers and improve performance and efficiency. Continuing education plans for both time and short time should include the following: priority areas of training for each group, specific training resources available, budget for training, sources of funding, the date, and the venue of the training. Also to be include monitoring of training, inventory of availability of training institutions, identify suitable experienced and qualified educational resource persons. There must be the issue of learning materials to be used, which must be well addressed, and very importantly, the issue of adequate supervision. Conflict is often common in workplaces, and therefore there is always the need for conflict management or conflict resolution. What is our understanding of conflict management? Conflict management is the practice of recognizing and dealing with disputes in a rational, balanced, effective, and a fair way. It also refers to techniques and ideas designed to reduce the negative effects of conflict and enhance the positive outcomes for all parties involved. We should be aware of sources of conflicts in our workplaces. It includes competition for scarce resources, different values and interests of the people, particularly people with different professional background and personality, antagonistic roles of different people. This is common between different professional groups. Acquisition of power is also a potential source of conflict. And very importantly too is communication breakdown. What measures are available for us to use to resolve conflict? We have the use of authority, which involves the use of legitimate power to bring about compliance and observance. We also have a compromise, which involves bargaining and splitting difference. And splitting difference means agreeing a solution that is halfway between two positions and which appears to be fair. And we also have a third-party intervention, which involves the use of mediator. We also have the third-party intervention, which involves the use of a mediator. Part of conflict is discipline. Health organizations should have a code of disciplinary procedures. There is therefore the need to be familiar with guidelines on disciplinary procedures. To ensure fairness and order in processing disciplinary cases, health organizations should establish a disciplinary committee which will be given responsibilities of looking into all cases that has to do with disciplinary issues. Let us take this assignment. What practices can health leaders and managers adopt to improve the performance of their teams and workforce? It should be an online submission to be marked LMG assignment and should not be more than 500 words and should be mailed to iheartnigeria@gmail.com. The conclusion is that HRH is one of the building blocks of our health system, and it constitutes one of the most important resources in health on account of its costs and the value it gives to other resources. The importance of human resource also rests on its ability to mobilize and manage other resources. Managing key aspects of human resource for health has profound influence on the performance of the workforce. At all levels of the health systems, leaders and managers need to be capable of applying the principles of human resource management to achieve efficiency and effectiveness in the delivery of healthcare services. Our dream for a strong health system and better health outcomes will remain a dream unless we work for it. Strong leadership, effective management, and transparent governance is the key. iHeart is committed to the triple concepts of leadership, management, and governance in the health system.